I'm Viraj, and I'm the co-founder of Vitalize, where we're improving the well-being of our healthcare workforce. As a kid, I hated being sick and missing out on stuff. We all remember what it was like to have to skip recess and not see our friends at school, because at that age, that's all that mattered to us. But unlike every other kid, I missed out on so much more. My reality was getting sick every few weeks. This is 3-year-old Viraj. Seems like a happy-go-lucky kid, right? But that wasn't the whole picture. You see, growing up with really bad asthma that often led to pneumonia and respiratory infections, I spent most of my early birthdays in hospitals. I remember getting so sick that I couldn't walk up the stairs of my own house without gasping for air. But during all of this, my nurses and pediatricians were my second family. They taught me how to manage my asthma and stay out of the hospital. So when I got to college, I wanted to continue learning about these themes that were so central to my lived experience. But after 3 major changes, I was unhappy because I wasn't learning how to better healthcare for others just like me. So I started working with professors to build my own degree. I had no clue if it would work, but I was determined to study what I cared about. My first issue were that none of the topics were offered to undergraduates. So one by one, I gained permission to take every class in the Masters of Public Health curriculum. My second issue was getting the university on board. I initially got so many no's, followed by advisors not even replying to my emails. It wasn't easy, but 5 months later and dozens of meetings, the university approved my degree, health policy and technology. And it was around this time that I got involved in a student organization where I led a health intervention to India, teaching children about hand washing and malaria prevention. And seeing the efforts of our team help hundreds of families better manage their health was incredible. And I couldn't help but wonder the impact of this work if it could be done on scale. So I transformed this student organization into Public Health Beyond Borders, a nonprofit focused on empowering students to improve global health through education. We now have partnerships in 5 countries and have reached over 3,000 children globally through our work. And this work in global health then motivated me to actually get more involved in public health in my community. So I volunteered at a student mental health hotline. And week after week, I help students navigate accessing basic care on campus, like emergency mental health services. But this wasn't cutting it. So to support my fellow students, I co-founded Chat Health. We built a student health chatbot for University of Maryland and had over 4,000 users in our early months, and then pivoted to a mobile app that's now allowing us to help college students across the country stay healthy. So my college experience was transformative, right? It showed me that entrepreneurship is my path. But most importantly, it set the stones for me to work on Vitalize. Because growing up, my clinicians were with me every step of the way, from rushing to the emergency room when I couldn't breathe, all the way to getting accepted to my dream colleges. But over the years, nearly every clinician close to me has left medicine because of burnout. And seeing this, it had a profound impact on how I saw healthcare. And then the pandemic happened, right? And millions of healthcare workers suffered from incredible burnout. But for the first time in my life, everything came together. The what? The why. Now let's figure out the how, right? The more I learned about clinician well-being, the more I knew I needed to work on this problem. Today, over 60% of healthcare providers face burnout, and nearly 40% wish to leave medicine right now. So take a second to imagine that. 1/3 of our healthcare workforce gone. What does that mean when each of us need to access care? Reducing burnout is a top priority for every hospital in the country. So we dove right in. We spent $10,000 on an MVP with minimal customer discovery backing it. And we ended up with a product that no clinicians liked. It had over 7 features. We really lost sight of exactly who we were building for. So we started speaking to every clinician possible. And we learned that hospital employee assistance programs are too time-intensive and stigmatized, and that wellness apps fail to engage this population. So overall, current well-being solutions yielded low returns and really high costs for hospitals. And this is why we built Vitalize, a B2B subscription platform with a cognitive behavioral therapy app for individual healthcare workers and an analytics dashboard for healthcare leadership. And our revenue model is B2B. We sell our platform to healthcare organizations through per clinician annual subscriptions. But how does our product work? First, our app offers cognitive behavioral therapy content centered around things clinicians are experiencing each and every day. And this content developed by our team, that's the basis of our work, has been shown to improve mental health, resilience, productivity, and more among clinicians. Next, our app provides clinicians with stigma-free spaces to gain support, both through our digital peer support community and clinician-led group coaching features. And to improve engagement, we're currently building a reward system that provides users with real-life rewards for regularly engaging with Vitalize. And finally, through our dashboard, we provide healthcare organizations with targeted analytics on staff well-being and help them uncover drivers of burnout. And we're confident that this is the right time to enter the market. Competitors like Even Health and Marvin have created technology-enabled solutions for healthcare, but they focus on providing generic teletherapy that's already covered by employee assistance programs and have poor engagement. And they don't provide analytics to organizations. So with this, Vitalize looks to capture $100 million over the next 8 to 10 years. We've raised over $100,000 in non-dilutive funding to bootstrap launching our first 2 pilots with over 250 nurses and physicians. We recently recruited a world-class advisory board with over 65 years of clinical and hospital sales experience to accelerate our customer acquisition. But most excitingly, we're in late-stage talks with the largest social care provider in Europe to close a $120,000 contract, which we hope will close by this June. But from day one, we've been focused on building something that clinicians will use. Early in our journey, we recruited 50 clinicians to co-design our product with. And we just published peer-reviewed research to back this product development process. Recently, we found that over 70% of users wanted to use Vitalize at least 5 times per week. And in our current pilots, we're rigorously collecting data and product feedback with 3 KPIs in mind toward our longer-term goal of showing concrete changes in burnout and turnover rates in hospitals. But our focus this summer is executing on paid pilots and converting these into annual subscriptions. Our sales pipeline focuses on leveraging existing connections with the American Hospital Association, existing nonprofit partnerships, and the global network of both our chief medical officer and advisory board. We expect to sign our first 4 contracts with hospitals this year and to reach over $500,000 in contracted ARR by the end of next year. And in the longer term, we want to secure multi-hospital contracts with health systems. But throughout this, we do recognize the length of our sales cycle selling to hospitals. And because of this, we've projected our greatest growth in sales volume starting in 2024. And I'm proud to be surrounded by a team that's ready to make Vitalize the to-go staff well-being and engagement solution for the healthcare sector. Our team combines over 15 years of clinical experience in hospital sales, work at top 2 healthcare venture funds, multiple founded ventures before Vitalize, and engineering talent from one of the country's most promising healthcare startups. Overall, my journey is one of learning and discovery, one that reflects a vision for a healthcare system that can better serve patients just like me. But after graduating from University of Maryland last spring, I knew I had to learn more from other healthcare systems around the world. So I was awarded a fellowship by the Bill and Melinda Gates Foundation to pursue a fully funded PhD in public health at the University of Cambridge, which I just started last fall. And each day in Cambridge pushes me to become a better researcher and entrepreneur. But right now, I'm all in on Vitalize. I envision a healthcare system where every clinician has the resources to manage their well-being right at their fingertips. And to start, we have a goal of reaching 100 hospitals in 4 years while achieving 2 UN Sustainable Development Goals in the process. But most importantly, Vitalize is and will always be an opportunity to pay it back to the clinicians that I wouldn't be here today without, those that had been there with me since I was in the hospital at 2 years old, because I'm building what I wish they had all those years ago. And I wanted to thank GSEA for your continued support of my entrepreneurial journey. Thank you so much.